Good afternoon, everybody. I'm Adam Mayberry. I'm the lead public information officer for the Washoe COVID-19 Joint Information Center. Appreciate you tuning in. As you know, we've had our first fatality as a result of the virus, and we want to provide some helpful information to your immediate partners from our incident commander, Sam Hicks, and then we will hear from our Washoe County District Health District Officer, Kevin Dick, and address some of your questions. Some of you have written in questions. I'll make sure that we read those and get a response. Thank you again for your patience and working through us on this. Without further ado, I'm going to introduce Chief Sam Hicks.
Good afternoon. My name is Sam Hicks. I'm the Incident Commander for Washoe County COVID-19. To start with, our team would like to express our deepest gratitude and sympathies to the deceased family and friends. It's a tough time, and our thoughts and prayers are with you. This is a highly evolving incident. There's a lot of unknowns for us as an incident management team. We continually work day in and day out with the health department to provide the best services we can to the community. We are working tirelessly with the health department. They're fantastic partners, and we are faced with many challenges every day. Some of the things that we're working on from the incident management team, part of it is alternative housing. Should we see a surge in cases that need to be quarantined, but they don't have a place to go to? Some of the other things we're working on, we're evaluating sites throughout the towns, meaning Reno and Sparks and Washoe County. Our team has reached out to a team in Spokane, Washington, who is doing the same thing up there. They're faced with the same challenges we are in the fact that we don't have good numbers or ideas on how to combat this. What we do know is that social distancing, hygiene is a huge part of this pandemic. And if we can please stay home, social distance yourself, that is the number one way that we can flatten the curve here. We're really struggling with this. Essential businesses that are open, please tell your employees if they're sick to stay home. I would recommend implementing screening for those businesses that are open for your employees. The health department has guidelines on screening for their employees, and if an employee is sick, send them home so that they can get better. That's the only way we can combat this curve and flatten it out. We continue to see numbers increase daily. The health district officer can talk about that. Our goal is to flatten the curve, and I can't stress enough, please help us spread the word to look at the Washoe County Health Department website for guidance on social distancing, isolations, any other ideas to help curb this pandemic. Thank you. Have a good day.
Good afternoon. I'm Kevin Dick. I'm the District Health Officer for the Washoe County Health District, and we're extremely saddened to report the first COVID-19 death in Washoe County. And on behalf of the Health District and our community, we offer our condolences to this family for their loss and this tragedy for our community. We'll offer a few details about the case, but from a public health perspective, but out of respect for the family, this will be limited. The individual tested positive for COVID-19 on March 23rd. He was a male in his 40s. The person had a travel history. They had traveled to New York City, and they were hospitalized on the day they were diagnosed on March 23rd. I have an update on the number of confirmed cases. We've had 4 additional cases confirmed since our press release earlier today, so we now have 111 confirmed cases. We have an additional recovery, so 9 people recovered in our community, and we have 101 active cases currently. As Commander Hicks mentioned, we have had increasing numbers of COVID cases reported. We had 18 cases reported yesterday. We have 18 additional cases reported today. And so that means we are not flattening the curve. And our first COVID death and these increasing number of cases need to be a call to action for everybody in our community to redouble their efforts, to take social distancing measures, to wash your hands, to clean surfaces, to not go to work when people are sick. This is a very real threat to our community, and I think it's time for everyone to take it seriously. I can tell you that I've been quite disturbed with what I've heard from some of our case investigations of people that have been diagnosed with COVID-19 in our community that were out shopping while they had symptoms, who had gone to work when they had symptoms. These are things that facilitates the spread of this disease in our community. And so if people have symptoms, you need to stay home from work. You need to stay home and self-isolate. I've also heard that we have employers in our community that have told workers that they need to come to work even if they're sick. This is also a huge threat to the public health of our community, and those employers should recognize that this is a threat to their entire workforce if somebody comes in sick and exposes other people at their business and makes other people ill. So please heed our warning. Follow our direction as far as staying home and isolating. I would like to say I have seen a number of cases that are quite encouraging in our community. Was out the other day and observed that people were social distancing while they were walking around to avoid other people that they encountered. I was at a store that had social distancing measures in place where they had places marked for people to wait in line with their shopping carts before checking out. They had social distancing marks in front of the deli counter for where people should stand. They had plexiglass up to protect their cashiers. So I'm very pleased to see those actions being taken. I'm aware that they're not being taken everywhere, so I would encourage everyone to think about how they can set up their operations if they are an essential business to be protective and to provide for that social distancing. So with that, I would like to thank Incident Commander Sam Hicks. He has my full support, as does his incident management team. He's been a great partner in this. We'll continue to work together to address the needs of our community. And with that, I will turn it back.
I'll ask a question.
You'll ask a question, okay.
Then we'll just play off of each other.
Thank you.
Thank you, Kevin. I do have a few questions from some of you out there. I'm gonna read the questions, and then I think most of the questions are going to be directed to you, our District Health Officer, Kevin. Dick, has this man been in close contact with others in the community?
Thank you, Adam. So this gentleman, we did do a case contact investigation with him, and I did identify some close contacts that the individual had, and our epidemiology team has followed up and contacted those cases for them to be self-quarantined and observing for any symptoms that may develop.
I have 5 questions left. With the increase in patients in Washoe County, are we seeing an increase in the number of hospitalizations, or are these cases being treated at home?
So fortunately, the vast majority of the cases that we have are able to self-isolate at home to recover. But with the increasing number of cases, we have seen an increase in hospitalizations that have occurred. We currently have 14 Washoe County residents that are hospitalized for COVID-19.
We've had people contact us saying they are suffering flu-like symptoms and they have tested negative for the flu, but they were sent home without a COVID test. At what point will the county be testing everyone with flu-like symptoms?
I'm afraid I don't have an answer to that question right now. I can tell our audience that we have been working vigorously to try to expand our testing capacity. I think everybody has seen in the news shortages nationally of tests being available. We have worked to ensure that our state lab, through Dr. Pandori's efforts, has done a great job to be able to maintain their testing capacity. And we're working to increase the supply of the test collection kits that we have to be able to utilize in the community. Our hospital partners are also working to maintain their testing capabilities and to increase those. They're now utilizing commercial labs as well for that testing. So we are seeing an increase in the capacity for testing locally, and we'll continue to work to increase that capacity. In the meantime, I would say that people should be working with their physician, working with our hotline, the 328-2427, regarding concerns about symptoms and COVID-19, so that we can continue to work to prioritize the cases that should be tested with the tests that we have available.
Thank you, Ken. If someone recovers at home from their flu-like symptoms but has not been tested for COVID, at what point is it safe for them to end their self-quarantine?
So my recommendation for somebody that has recovered from a flu-like illness but not been tested for COVID-19 would be that you wait for 7 days after the first onset of your symptoms. And then, so make sure it's 7 days past symptom onset, and you have at least 3 days, 72 hours without any fever and without taking any fever-reducing medication. If you were a case contact with a COVID case, however, I would then say in that case you should follow the direction that you received from our EPI team that made contact with you for that 14-day quarantine period. In case what you had was the flu or something else and not COVID, you still may be in that incubation period and might develop COVID. So for a case contact, it would be that separate situation of that 14 days of self-isolation to get through that incubation period.
Two more questions. We will open up for questions from all of you. We know the governor is expected to speak in about 15 minutes as well. Washoe County's first COVID-19 death was a man in his 40s. Statewide, the demographic with the most infections is age 30 to 39. Should this be a warning to people that this coronavirus is a threat mainly to the elderly?
So I think that this should be a warning to all of us, that we have a fatality that's an individual in their 40s. That's our first fatality in our community. We've heard a lot about how our elder population of 60 or older is at greater risk of having severe COVID and of potential death from the COVID disease. But this is a warning to all of us that we all are susceptible, that we can die from COVID. We have seen across the country, we've seen cases where a young infant and children have died from COVID disease. As far as the high number of cases of people in their 30s, I think those people may be more active and have more different contacts in our community. They may have a sense that they don't need to be as concerned because they aren't in that elder population. But I would caution everybody to be careful and to follow our direction, because if you are susceptible to getting the disease, even if it doesn't make you severely ill, that then also makes you a person that can be transmitting this disease in our community and potentially transmitting that to other loved ones that you have that are in those higher risk categories.
And Kevin, a follow-up from that question, is there an explanation as to why there's such a high infection rate among people 30 to 39 in Washoe County?
And I don't have a science-based explanation for that. I think my speculation is because they are out in the community more and maybe taking less precautionary measures than some of the higher risk individuals.
Thank you, Kevin. Are there any follow-up questions from our media partners out there that you'd like to ask Kevin Dick or Commander Sam Hicks?
Yeah, Adam, this is Jason from the Reno Gazette-Journal. Do you know if the person was relatively healthy or if he had any underlying conditions at all?
I'm currently not aware of underlying conditions for this individual, but we are investigating that, and I'll provide that information if we discover that there were.
Hi, Kevin. It's Bill Denser from the Review Journal. Of the 14 who are hospitalized, are any of them in ICU? Can you give us any information on that?
I'm afraid I don't have those numbers here for you.
Hi, this is On from KUNR. Do we have any medical professionals that have tested positive for COVID-19 in Washoe County?
I believe that we do have medical professionals that have tested positive for COVID-19, but I don't have the count here with me.
This is Michelle from the Nevada Independent. Can you clarify what the situation is with the ability to test in northern Nevada? Governor said that they were running out of tests in southern Nevada. Do we feel like we have enough for all the testing we want to do?
We don't have enough for all the testing that we want to do. That's what I just addressed, that we're trying to increase our capacity. Our state lab has several weeks worth of capacity, and they have strategies for continuing to procure the resources that they need to continue to conduct that testing. We also have several weeks of capacity with our sample collection kits, and again, we are working in conjunction with the state lab on strategies to sustain that supply into the future. We're also working with other partners to try to enhance testing capacity and availability of different types of testing in the community. I know our hospitals are working to ramp up testing, so we're hopeful for some positive outcomes of some of the measures that we're taking now that will allow further expansion of testing in the future.
A follow-up question. Have we had to expand into any, say, emergency type of hospital expansion facilities to accommodate the patients that have COVID-19?
We haven't had to expand our capacity as far as treatment for patients. Several of our hospitals have taken action, though, to establish emergency department triage facilities where they've used some of our or obtained their own hospital tent facilities so that they can triage people that are coming to the emergency department with respiratory syndromes. And so they're doing that to try to keep people out of the emergency department so that other people aren't exposed there. But it's for that triage measure, not for additional capacity for treatment.
This is On from KUNR again. Do you have any updates with regards to PPE?
Okay, I was getting a little echo there, but I think the question was whether I have updates on PPE equipment. And I can tell you that our incident command team is working aggressively to try to procure additional PPE for our community through commercial routes of procurement. We've also received some supply from the Strategic National Stockpile of PPE. That supply for Nevada was provided at less than 25% of the resource request, but at least we did receive that supply out of the stockpile, and that has been distributed to our acute care hospitals here in the community.
This is Michelle again. We've heard that there were some companies that have made major donations of masks and other types of equipment, and there was even a shipment from FEMA, I guess, that came in on Friday. How fast are we burning through the PPE equipment? I don't know if you know statewide, but maybe just in Washoe County. How much demand is there for that stuff?
Well, I think the demand is exceeding our supply. currently, and that's why we are prioritizing on the allocation of PPE to the acute care hospitals. But I don't have a figure to give you on the burn rate for it. One more question.
You mentioned that employers are potentially telling their employees to show up whether they're sick or not. Is that something that the county is going to go investigate and possibly enforce? I mean, how widespread is this, and is it that kind of action necessary?
What I would like to do is to have people heed our message, to not have people come in if they are sick. But I would not rule out that we would begin taking action against employers if we can show that those allegations are substantiated. So,
Thank you.
thank you.
Question for Commander Hicks. This is Stanton Nicolo. Is the county monitoring supplies in the grocery stores, and how are we doing as far as supplies go?
This is Sam again. We are not monitoring supplies in the grocery stores at this time. I'm not sure if the county, a branch of the county is doing that on the side, but that's not one of our tasks that we've been tasked with as of right now.
Thank you. We are going to have another press conference for you tomorrow at 11 o'clock that will include our statements from our key elected leaders in the region, the Washoe County Chair, our mayors of our cities. So we'll provide the appropriate information to you here in short order for a press conference tomorrow, Monday, at 11 a.m. We appreciate you tuning in. If you have any follow-up questions, you need any clarification, just simply reach out to me. You should have my contact number. And we have a pretty active team on the Joint Information Center. We'll make sure that we follow up with you. So thank you all for tuning in, and we'll look to see you tomorrow. Thank you.